So the findings, some of the findings from the interviews that we did with, as part of our clinic project with care, in association with Care Champions, we found a number of very concerning findings under kind of a number of broad headings. So there were extreme failures in care and treatment of people. That could look like neglect, could look like failure to ring for a doctor or an ambulance when that was clearly necessary. Lots of different failures in that regard. There were failures in terms of communication, both communication, both, sorry, start again there. There were failures in terms of communication between nursing homes and family members and loved ones, so failure to communicate in a timely manner, the communication of false or misleading information with regard to people's well-being or people's conditions, maybe the fact that they were deteriorating. There were people getting calls out of the blue that their family member had died after just having been told that they were fine, a short time previously. There were failures in facilitating alternatives to visitation, to in-person visitation. So although you were supposed to facilitate outdoor visits or window visits or virtual visits, these weren't always facilitated, and when they were, quite often they weren't suitable anyway because of maybe it was too noisy, maybe someone didn't know how to use the technology, there wasn't enough care staff to facilitate that properly. And then there was obviously the failures in oversight, so a lot of people making complaints and not feeling heard, not feeling acknowledged at all. So that's just a handful of things that we found from our interviews, just a small number of interviews with affected families.